I'm John Strum, and this is RealTalk MS. It's December 31st, and we have a lot to talk about. I hope those of you who celebrate had a wonderful Christmas, Kwanzaa, or Hanukkah, and I hope everyone is ready to usher in a happy and healthy new year. As I mentioned last week, I always reserve the last 2 episodes of the year to revisit the most compelling, most important conversations I've had over the past year. Certainly, one of the most important MS research events every year is the annual European Committee for Treatment and Research in MS Scientific Congress, usually referred to by its acronym ECTRIMS. I heard many attendees say that this year's ECTRIMS meeting was particularly important, and I would have to agree with them. If you'd like to hear from the experts who made some of the most important presentations this year at ECTRIMS, I'll invite you to check out the RealTalk MS YouTube channel, and you'll find that link in today's show notes. You made our podcast episode that followed ECTRIMS the most downloaded episode of the year. So this week, I'm revisiting the 2 conversations that I had immediately after the ECTRIMS conference ended. In what's become an annual tradition, it's my privilege to sit down with the National MS Society's Executive Vice President of Research, Dr. Bruce Bebo, literally minutes after the conclusion of ECTRIMS to get his first impressions of the news and presentations that caught his eye. In just a moment, you'll hear my conversation with Dr. Bebo. There are a lot of really wonderful parts to an ECTRIMS meeting, but one of the favorites of mine is what happens as soon as the meeting's over, and I get to sit out in front of the conference center with the Executive Vice President of Research for the National MS Society, Dr. Bruce Bebo, and ask him what caught his eye. So, Bruce, what was of particular interest to you at this ECTRIMS meeting?
Yeah, thanks, John. And it's lovely to be outside in the sun in Copenhagen, Denmark, at the world's largest meeting focused on research in MS. I think about 10,000 people at this meeting from all over the globe, just here to focus on share their results and findings and provide an opportunity for interactions and collaboration. It is the highlight of the year if you're an MS researcher, and it's been a terrific meeting. And just kind of first impressions walking out of the convention center, I have some good news and some bad news. I'll start with the bad news, or kind of bad news. So a trial of the cholesterol-lowering drug simvastatin was reported out at the late-breaking abstract session I just let out a few minutes ago. It's a study that was supported by the National MS Society in the U.S. and supported by the National MS Society in the United Kingdom and the federal government of the United Kingdom to look at a very common drug that lowers cholesterol, simvastatin, where there was no commercial incentive to explore the benefits of this drug in MS, but certainly a public health strong rationale to study this drug because of early studies looking at the ability of this drug to slow down the rate of brain shrinkage in people with progressive MS. And that early study revealed that this drug could reduce the rate of brain atrophy or brain shrinkage by about 40%. So we had to study this drug and look for a clinical effect in people with progressive MS, but there was no commercial incentive to drive this program. So we collaborated with the UK MS Society and with the British government to fund, I would say, an industry-grade phase 3 study of this of simvastatin in progressive MS, and a first of its kind collaboration. Unfortunately, there was no benefit for people in the group taking simvastatin compared to the placebo group. I would say, John, a very definitive, clear answer that it's negative. And so I think that's of course disappointing. We would certainly love to have more and better options for people living with this form of MS, progressive form of MS. So disappointing that it was negative. But the positives, I would say, is it was a very well done study, commercial grade study. There's a lot more we can learn from this study, but more or less we can check the box on statins and move on to the next thing.
You know, when we talk about the nature of this study, the fact that it was not financed by any pharmaceutical company, as you pointed out, we're looking at a 6-year study involving over 1,000 participants. This was a huge undertaking to do it privately.
Yeah, and I'd add that it happened during COVID. So an extra wrinkle to getting a study like that done is to course correct and pivot and come up with creative ways for collecting the data that was required to get the study done during the pandemic. And so there's some learnings from that too, I think, about how we can more collect information more remotely, make it a little bit easier to participate in a trial by perhaps making some of the visits remote rather than in person. There's more data to come. The study finished recently. They're just getting at the data. There's MRI data that we're going to be really interested in looking at, and blood biomarker data, all sorts of interesting. This will be a study that keeps giving and will help inform future studies, but unfortunately the outcome was negative. Now, in the same session, there were a couple of other presentations reporting the outcomes of clinical trials for a drug called tolebrutinib that two phase 3 studies in relapsing MS and one study in secondary progressive MS. And in the study of relapsing MS, this tolebrutinib, this BTK inhibitor, did not slow or reduce the frequency of relapses in people with relapsing MS. Disappointing. But what those studies, the relapsing studies, did show was that people had a delay in the development of progression. And that delay and that observation of a delay in progression was also seen in the third study that was presented. This was also a study of tolebrutinib in secondary progressive MS, in people that had secondary progressive MS for a very long time, that had very few, if any, relapses or very few, if any, signs of inflammation in their nervous system. And tolebrutinib was able to show also a delay in the accumulation of disability in 2 trials, about the same magnitude in all 3 trials. So this has never been shown before, that 3 clinical trials showing a slowing of the rate of disability at a pretty high magnitude in a population of people who are really in that progressive phase of the disease. So there's a lot of buzz around the meeting. Again, this is also a study that we're just learning. We're at the very beginning. We know the top line results, but there's so much more to learn from imaging, from biomarkers, from all sorts of kind of analysis. I predict, John, we'll be talking about this study for probably the next 10 years. The hope is that these results will convince regulators eventually to approve this treatment for people with secondary progressive MS that are in that more advanced, I would say, phase of disease.
I wouldn't be surprised to see an effort being made to gain approval for people with relapsing forms of MS as well.
Yeah, could very well be. I think perhaps the thing to mention is that while the results for the relapsing MS trials were negative, they were comparing this tolebrutinib to Aubagio, and both drugs had a very robust effect on reducing relapses. The trick was that the tolebrutinib didn't show a significant effect compared to Aubagio. But I'm quite sure, as you're alluding to, that there is likely a strong effect on relapses. It just wasn't measured in this trial. It points out that doing trials in relapsing forms of MS, when we have so many effective therapies, is becoming ever more challenging. And that's also maybe the theme of this is good news and bad news, right? The good news is we have a lot of effective disease-modifying therapies for relapsing MS. The bad news is it's going to be harder and harder to develop new ones because we have to show that they're superior to the old ones in some way or other. So that's the good news, bad news about that project. There's some other things that struck me certainly yesterday. The highlight was presentation of, I'd say, high-level presentation of a proposal for a new diagnostic criteria for multiple sclerosis. So perhaps some of you have heard of the McDonald criteria. They were last updated in 2017. We know a lot more about the biology of MS, what's driving different subtypes of MS and stages of MS. And we'd love the diagnostic criteria to be more biologically based, and goal really of diagnosing people earlier and more accurately. So there were some pretty significant changes proposed to the diagnostic criteria that I think will push the diagnosis of MS ever earlier and provide more opportunities for treating people earlier in their course of the disease, likely with much better outcomes as a consequence. So that was, I think, the buzz from yesterday on the diagnostic criteria. And then one more thing I'd share, John, is there's a lot of momentum and a lot of presentations this week about women's health and the specific sort of experience and biology that drives disease in women compared to men. And so this has been a unfortunately understudied area. Women with MS have a lot of questions about reproductive health, about menopause, about hormone replacement therapy, about all sorts of questions about being a woman with MS specifically affects their disease, their treatment of disease, their experience with disease, and we don't have a lot of answers to these questions. So there were several sessions this week highlighting what we know, what we don't know, and I think have put a big eye on this topic. Of course, MS affects women 3 times more often than men. 60-70% of everyone with MS is a woman. It's a bit shocking that we haven't really dove into this as much in the past as we are now. Can't do much about the past, but we can look forward and try to do more. This was catalyzed by a panel of papers that were conceived of and written by the International Clinical Trial Advisory Committee of Clinical Trials in MS, which is a committee that the Society sponsors along with the ECTRIMS. So I'm proud of our role in elevating the conversation and putting light on the issue, and I'm looking forward to us doing more to shed light on those important questions and give women with MS the information they need to manage their disease in the best way possible.
Well, I appreciate getting your bird's eye view of the conference. Everyone I've talked to seems to have been coming away saying this was a particularly impactful one. Lots of information that is going to give researchers everywhere opportunities to move the ball further down the field.
I couldn't agree more. And then we haven't talked about this, but we usually do like a post ECTRIMS like 2 or 3 weeks later. This is right out of the gate. This is top of the mind stuff. But of course, there's so much more to talk about, John. So hopefully either myself or somebody, we can have another conversation in a few weeks once we're able to get back home. The jet lag is gone. We can really dig in and think about it and share even more about ECTRIMS in the coming weeks.
Be careful what you wish for. I'll be calling.
Yeah, awesome. Look forward to it.
Bruce, as always, thank you so much for your time, for the great mini presentation. If you haven't been to ECTRIMS, you just got the highlights. And safe travels home.
Thanks, John. You too.
This year, I also wanted to bring you the perspective of someone who's living with MS, who is attending ECTRIMS for the very first time. So less than an hour after the conference concluded, I had a conversation with Kristine Werner Ozug. Full disclosure, Kristine is a member of the RealTalk MS team, and I want to thank so many of you who emailed or DM'd me to let me know how much you appreciated hearing Kristine's perspective on ECTRIMS 2024 when it originally aired. Here's my conversation with Kristine. Well, we've just reached the end of ECTRIMS 2024. ECTRIMS is the largest MS research conference in the world. This particular year's ECTRIMS conference was full of great information that we're going to be sharing with you. Joining me today is someone you haven't met yet, but Kristine Werner Ozug actually joined the RealTalk MS team just a little while ago. This is her first trip to ECTRIMS. So as someone who's living with MS, give us your impressions of being at the largest MS research conference in the world.
Thank you for having me on. The experience was like no other. I think there were about 8,000 or 9,000 people in attendance. They said it was a record-breaking year for attendance, and this was the 40th year of ECTRIMS. One of the things that I was really impressed by as they were walking through the timeline of ECTRIMS was that in the very beginning, they said there was about 18 people that met in the back of a pub, and it has morphed into what it is today, which is the world's largest MS research conference. The theme this year was dedicated to the dedicated. And I got a little emotional when I saw that, because there are people that come from all over the world, researchers and clinician scientists, who are all trying to find the trigger, the source, the biological mechanisms, the pathology, the reasons why people are getting MS, the reasons why people are progressing in the disease, and people trying to develop targeted therapies for people like me and people listening. So it was a wonderful thing to see. There were over, what did they say, about 16 to over 1,700 abstracts that they covered. So obviously, we won't be covering them all. But there, like John said, there's a lot of great information, great announcements that were made, and exciting news and exciting research going on.
So, there's always been this ongoing debate among some people who are living with MS as to whether or not they ought to be at these kinds of conferences. Frankly, they're not set up for the patient community. And by that, I mean, they're expensive to go to. The registration is costly, and the days are long. It's not a place for fatigue to set in. So given all that, what's your opinion? Is this a place for people who are living with MS?
I would definitely agree. Although I enjoyed attending, I am involved in a lot of different research initiatives. It is not set up for patients. The audience is not a patient audience. This is a research-driven conference. The audience is researchers and clinician scientists, and the topics of discussion are very scientific, data-driven outcomes.
They're all using their wonky, science-y language, and it makes it hard to decipher if you're not a scientist.
Yes, these are not plain language, and that's why we are here, to help people kind of navigate the, hot topics, if you will, that have come out of it.
Speaking of those hot topics, what resonated most with you of all the things you've seen and heard, all the people you've talked to over the last 3 days? What's top of mind?
So they designated several areas that were hot topics for the researchers, as well as what they thought the community would be interested in. I think they aligned well. Some of the hot topics were things like neuroprotection, pathogens such as EBV and MS, different types of data-driven research, different types of foundational research. I think what resonated with me the most that I did not anticipate was a lot of talk about women's health issues in MS and how they have been understudied in the past, even though we make up between 70 and 75% of the population affected by MS. And there's been quite a bit of research and presentations at this ECTRIMS around that.
It's funny. All of a sudden, you stop and realize, with women being diagnosed with MS almost 3 times more often than men, making up the vast majority of people with MS, you would think this was common sense. And yet somehow it's not. And when you look at women's health issues in general, women have to deal with things that men don't think much about: pregnancy, menopause. And so over the lifespan, as a woman's biology continues to evolve over time, and that woman happens to have MS, that MS is affecting those changes in her body, and those changes in her body are affecting her MS. So the fact that it hasn't been studied in more greater depth than it has been is shocking, but it looks like the tide has turned, and we're going to see a lot more research being focused on women's health issues.
Exactly. It was interesting to hear the buzz around that. And I was kind of surprised, like you, that it's this obvious kind of thing that just hasn't been widely addressed. And I'm really happy to hear that it's kind of taken off in this direction now. So I'm hopeful that those of us women like me living with MS are going to start hearing more and more news around the issues that you just mentioned.
Aside from that particular topic, any other news, announcements, presentations that caught your eye?
I think of course, the announcement of the modified McDonald criteria, which is the criteria that neurologists use to diagnose somebody with MS, is important. And of course, it still needs to be published and peer reviewed before it's, put into practice. But the takeaway for me was that it's going to help people get diagnosed earlier, more quickly, more accurately, and avoid misdiagnosis of MS. Those things are all very important. And I think it will also help reduce the amount of, unpleasant things like spinal taps that people may have to go through for diagnosis. The reason why I was kind of moved by this criteria is, for me personally, it took over 5 years before I got a diagnosis. And if a couple of these criteria were in place during the time I was trying to get a diagnosis, I would have received my diagnosis earlier. So I'm very excited for the people who have yet to be diagnosed, because I think this will help them get treatment early.
We don't talk about it very much, but the degree of misdiagnosis in MS is alarmingly high. People get it wrong. So people who don't have MS are frequently diagnosed with multiple sclerosis. They end up going on a disease-modifying therapy, which everybody knows is a costly endeavor, regardless of your insurance. And they're on it sometimes for years before they realize, or someone who's caring for them, whether it's a neurologist or another specialist, they realize, hey, this person doesn't have MS. They can stop taking that DMT. On the other hand, you have people who have MS who are misdiagnosed as not having MS. Someone like you who spent 5 years wondering what the heck's going on. And those 5 years could have been spent on a disease-modifying therapy. We all know that early intervention leads to better outcomes. So the sooner you get an accurate diagnosis, the better the long-term outcome is for you.
I think this is a great modification to the criteria, and of course will help everyone. They also mentioned that some of the changes have the ability to help countries that are more underserved, that may not have all of the technology that other countries do, to be able to diagnose people faster and more accurately. So I think that was also a big plus to the modification of the criteria.
There are countries with people who are living with MS in them who have one MRI machine. And so, yes, it makes it really, really hard. The more you can provide options for an accurate diagnosis, all the better.
Yes.
So anything else top of mind? Anything else catch your eye? Anything else worth talking about right now?
The other big news were the phase 3 trial results for the BTK inhibitor, tolebrutinib. And there's a lot of news around that. And there were some pretty positive results that came out of the Hercules trial, which was for non-active secondary progressive MS, which was great because right now there are no therapies for that population. And the results show that there was a 30% delay to progression time over placebo. So it's good news there for people. It looks like they may have an option. They still have to go through FDA approval for this drug. There was a lot of excitement around that announcement today.
So this year, ECTRIMS was in Copenhagen. It moves every year, different city. How was Copenhagen for you?
It's a beautiful city. People are very active here. A lot of people biking every day, walking every day. The weather has been wonderful. I've heard in the past when people have come here, it has not been warm or it has not been sunny. We've been very fortunate that it's been warm and sunny. And I find it to be very welcoming. I've found the food to be wonderful, and I've met so many great people at the conference, so many brilliant minds, so many people dedicated to finding the cause, finding a repair mechanism, finding biological reason, a genetic reason to help people like me and people listening. And so it just made me very hopeful, and I'm just very appreciative of the experience.
I appreciate you sharing your thoughts. And that's Kristine's wrap up for ECTRIMS 2024. Well, that's going to wrap up 2024 as well as this episode of RealTalk MS. RealTalk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/383. You'll find that link in today's show notes so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free RealTalk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of RealTalk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and Happy New Year.